Lobar pneumonia. Definition. Pneumonia is defined as an inflammation of the lung parenchyma. The inflammatory exudate will result in consolidation. That means it will become solid like any organ like the liver. The pneumonia is classified according to the anatomical nature. Lobar pneumonia, entire lobe is involved. Bronchopneumonia, around the bronchial tree. And interstitium in between the lobes or the alveolar spaces. So three types you must remember: lobar, broncho and interstitial. The etiological classification is generally common to all. It can be infective, bacterial, viral, mycoplasma and fungal. Aspiration pneumonia in a case of children. And the normal defense mechanism in our body is mucociliary clearance. The cilia in the respiratory tract, they remove the unwanted substances. Cough reflex, again for removal. And when it goes into the alveoli, they are phagocytosed and removed. These three are the normal defense mechanisms. In lobar pneumonia, the causes are pneumococci, Klebsiella, Haemophilus, and Pseudomonas. So this is the lung over here, and these are all the alveolar spaces. But they are all interconnected by means of these two things. You'll have to mention pores of Kohn, canals of Lambert. So alveolus. As a result of which you find entire lobe can become infected. So look at this picture first. So this is a lobe that has become consolidated. It is a case of lobar pneumonia. Now, what are the stages of it? These stages you must mention. Days and hours not very important, but okay. Congestion within 24 hours. Red hepatization 2 to 3 days. Gray hepatization 4 to 6 days. And more than 6 days will be a resolution, normally up to 10 days. So initially you find that the lung is boggy and red. Again red and liver-like. That is why it is called hepatization. Then grey-brown and again liver-like called hepatization. Finally, there is the restoration of the normal architecture. This you people must try. The complications can be organization, that is fibrosis, septicemia, and infection can spread to distant sites. So beautiful picture of the lobar pneumonia over here. Entire dark pink is the pneumonia lobe. Whereas here it is patchy and this is a bronchopneumonia. The differences will be seen in a tabular column. Investigations are chest X-ray, culture and sensitivity of sputum. For AFB also you will do, and any other tuberculosis related investigations. So lobar pneumonia, these are all the things that you people see. So middle-aged or young, the organism is virulent, mainly pneumococcus, entire lobe through the pores of Kohn, and sometimes you find it is telescoping. Forget it for the time being. Less than 10% can develop empyema or infective endocarditis. Bronchopneumonia, on the contrary, occurs in the old age, debilitated or sick patients. Organism is not very virulent. These are the organisms. And there are patchy areas of consolidation around the bronchial tree. It responds, but it depends on the underlying disease. Falls by lysis. Complications: lung abscess, empyema, and distant spread. So this particular table is important for two answers. These are the stages. Those are normal alveoli, and in the alveolar capillaries, it is filled with RBCs. They come out into the alveolar space, it becomes red in color, red hepatization. Replaced by the WBCs, so a gray color develops, it is gray hepatization. Finally, all are being removed and it is called resolution. Lobar pneumonia